Hello all. Welcome to this session of Academia IAPSM. Today's topic is Must Knows of International Health. I am Dr. Somdatta Patra. I work as professor in the Department of Community Medicine of University College of Medical Sciences, Delhi. What we are going to learn in this session, we are going to learn what is international health, what are the domains of international health, functioning of some international health agencies, key features of International Health Regulation 2005. So we start by knowing what is international health. As it is widely said, health and disease have no geographic boundary. They don't have any national boundary. A disease present in any part of the world is a threat to other parts of the world. There is interdependence among the countries for better health outcomes. So, international health is that branch of health sciences which functions to improve health and deals with related challenges and facilitates cooperation between the countries on a global scale. How it functions? It functions by collaboration and cooperation between countries, governments, non-government organizations. In relation to international health, these non-government organizations or NGOs are also known as international health agencies. Can you name some international health agencies? Yes, they are WHO, World Health Organization, UNICEF, USAID. Besides countries, governments, non-government organizations, other key stakeholders are healthcare professionals, researchers, academicians, and communities. What are the domains of international health? The first and foremost is global health security. See, not only infectious diseases, they have the potential to spread. There are many other public health related events like chemical events, radiological or nuclear meltdown, climatic changes, they affect health. So all these have potential to affect from one part of the world to other parts. Second domain is to work in the field of disease eradication, elimination, and control. Can you name a disease which has been eradicated? Yes, smallpox. Other diseases like polio, guinea worm, they have been significantly reduced because of initiative taken in the field of international health. The third domain is health system strengthening. See, health has not only biological determinants, it also has got social determinants. And the health outcomes, they are not same, they are different among the countries, also within the countries. So this field, they work so that all communities can attain good health. The fourth domain is to provide for humanitarian assistance and emergency response during natural disaster, human crisis. They work by providing emergency help, support, relief, and also providing and helping to restore the system. The fifth domain is maternal and child health. This works by improving the health of mother and the child. Sixth domain is health promotion and education by developing, disseminating the resources, by fostering community mobilization and community engagement. Seventh domain is capacity building and training among the healthcare workers, healthcare professionals. It also gives a very good platform both at national and international level for policy development, resource mobilization, and prioritization of health issues. Now we will discuss some important international health agencies. The first one is WHO, or World Health Organization. It was established in the year 1948 on 7th April. This day is celebrated as World Health Day. Usually every year we get a new theme so that some key areas of health can be focused in that year. Its headquarters is at Geneva. The objective is attainment of all people, the highest possible level of health. Now we'll discuss the structure and the regional organization. So all the members, they are represented at World Health Assembly. It is something like a health parliament. Few member countries are elected and represent at the executive board. Then we have Secretariat, which consisted of the administrative staff of WHO, and that is headed by Director General. The member countries have been grouped in 6 main regions. So we'll know the names of the regions and the headquarters. The region Southeast Asia, the headquarters is at New Delhi, India. Region Western Pacific, headquarters is at Manila, Philippines. Eastern Mediterranean, headquarters is at Alexandria, Egypt. Region Africa, headquarters Brazzaville, Congo. Region America, headquarters Washington, D.C., USA. Region Europe, headquarters is Copenhagen, Denmark. The functions of WHO: it provides technical assistance to the countries. It has worked as a leader in many public health achievements. Some of them are like smallpox eradication, control of spread of HIV/AIDS. It has worked in the field of control of communicable diseases like HIV, malaria, non-communicable disease like heart disease, cancer. Other important functions and important areas are biomedical research and health promotion. Now we'll discuss the second international health agency, UNICEF. So it was established in the year 1946. That time it was during World War II. It was established to provide assistance, especially food and health for the children. So the name was United Nations International Children's Emergency Fund. Later on, the words like international and emergency, these were dropped from its name, and it is now known as United Nations Children's Fund. Its headquarters is at New York. Its functions are child survival, child protection and inclusion, children's education. A flagship program is known as GOBI FFF. It's an acronym. G stands for growth monitoring. O stands for oral rehydration. B stands for breastfeeding. I stands for immunization. FFF, they are female education, family spacing, and food supplements. The third international health agency we are discussing today is International Labour Organization, or ILO. It was established in the year 1919 The headquarters is at Geneva, Switzerland. It is a tripartite United Nations agency consisted of government, employers, and employees. The objective is to set labor standards, improve upon policies, create programs that promote decent work for people. Now we shall be discussing international health regulation. We started the session by saying that health and disease have no geographic boundary. But you see, borders of a country are very important. So International Health Regulation, or IHR, is a legal instrument. It's a legal framework established by WHO. It is binding on all member states of World Health Organization. It helps to address public health emergencies. It helps to facilitate the cooperation between the countries, which can help to address public health emergencies or threats which are of international concern. So, International Health Regulation, which was formulated in the year 1969, that time that was done to address challenges posed by infectious diseases. In 2005, it was modified to address all public health threats, including infectious diseases, nuclear events, radiological events, chemical events. It has defined public health emergency of international concern. We'll discuss it in details. It has defined the health measures which need to be taken at the point of entries. Point of entry is at the point where an individual can enter to another country. So these are airport, seaport, rail crossing, land crossing. It talks about not only health measures which need to be taken at point of entries, but also containment at source. The importance of early identifications and assessment and response. It talks about adapted response, which the countries can take depending on scientific principles. So, what is potential public health emergency of international concern? WHO has said that countries can decide that depending on 4 decision criteria. It does not have a preset criteria. If a health-related event occurs, then countries need to assess, is this public health impact of this event is potentially serious? Is this event unusual and unexpected? Is there a potential for international spread? Is there a potential for travel and trade restriction? If 2 of these 4 criteria are met, countries need to notify WHO within 24 hours. Role of the countries are to assess and report. WHO's role is to make the decision. 4 diseases always need to be reported to WHO. They are severe acute respiratory syndrome or SARS, smallpox, diseases due to new influenza virus, and wild-type polio. So, what we have learned in this session, we have learned what is international health, domains, functioning of some international health agencies, key features of international health regulation. Thank you all. I acknowledge the contribution and guidance by UCMS team, eConnect team. Thanks. We end the session here.